هلو.
أيوة مرحبا يا برو.
كيف الصورة واضحة؟
أيوة الصورة واضحة والصوت واضح.
نبدأ الآن. Okay, Bismillah ar-Rahman ar-Rahim. Let us start this Sunday lectures on tropical medicine. And the title of today is Cancer in the Tropics. As you could see that we are moving from one platform into another platform. When we're talking about tropical diseases, we have, two types. The type one is which is geographically limited because of a vector or because of a local condition which determine the disease, like onchocerciasis, you need a fly, black fly. If it is trypanosomiasis, you need the TCTC fly. If it is Caladar, you need Phyllopotamus papatasis. And so these are the limitation of the disease. So, and this makes the disease unique to that area, and it is not shared between any other geographical area. This is classic, what we call classic tropical diseases, and luckily there is a lot of effort now being made to eliminate these diseases or control them as a public health problem, thanks to the effort of neglected tropical disease and the stakeholders in that. Okay, so there is another type of disease which is not limited to the tropics, but extending because of conditions in the tropics. For instance, the ciliary dysentery, amoebic dysentery, this is worldwide, even in developed countries, but it is more in tropical countries because it is, associated with some socio-economic status that is decreased. But now we are moving into what we call a disease in the tropics. A disease in the tropics means that we wanted to have a look, a close look about certain disease which is worldwide, diabetes, hypertension, cardiac disease, worldwide, but in a specific region of the world, which is the tropics. Even that, we wanted to move from the tropics as by defined, as by environmental definition, into countries of low to medium income, low to medium income, which is LM, income countries, LMIC. This is low to medium income countries. And this will encompass almost all tropical countries, and it encompass some savanna countries, and even some desert countries like Mauritania, Chad. These are almost like deserts. So it's widening our mandate from just giving you tropical diseases into to see what is the health, what are the diseases, what are the causes of mortality, why people are not very happy in certain parts of the world, like the tropics. Okay, so we wanted to look into the other factors. At the end of the day, I hope we will produce a doctor who is willing to work in these tropics and help in these tropics and have all the armamentarium to control diseases in the tropics. So that is the general principle of this. So take this title, Cancer in the Tropics, as an umbrella of what we wanted to deal with diseases in a certain setting. And the terminology is high income countries or low medium income countries. And there is another index called HDI, which is Human Development Index, Human Development Index. And countries are being divided very sharply on economical background, Countries which used to be third world countries like Kuwait, Saudi Arabia, now are coming up in the first group of high development income countries, high development or high human development index. So it's not only the tropics, the environment, the flies, the vectors, but it is now getting more and more into the socio-economic status of these countries. Okay, uh, infectious diseases has been steering the human history for quite a long time. True, we are bound by looking into these diseases from the angle of infection. Okay, but if they turn into epidemics, they are factors in the social economic status of the countries. Just remember COVID-19. This is, the whole world was closed, locked, nobody on the streets, economy was down, the social life has been disturbed. So these are the infections. And if I go back into the history of infections, we will remember that plague, three or four epidemics, pandemics, which ended up with more than 50 million deaths from epidemics of plague. All right, influenza, just another example. Influenza in the after the after the first war, after the First World War, the epidemic of influenza have killed 50 million individuals, mainly in Europe, while the war itself killed only 16 million. Okay, so it's so devastating. And then we had AIDS. You remember AIDS, 1983, when it came to Africa, it has a pandemic. And that's before the advent of antiretroviral therapy. And 44 million were affected, 9 million died. COVID, why do we go far? COVID-19 has been a worldwide, not only restricted to tropics, but it has really hit America and Europe more harshly than the tropics. And we reckon that there is 630 individuals had COVID, and we lost 6.5 million persons in that epidemic. Okay, so the diseases are now, according to WHO, divided into the communicable diseases and the non-communicable diseases. The communicable diseases, CD, and the non-communicable, NCD, the non-communicable. So what is communicable? Communicable is the disease which can spread between from man to man, animal to man, even a surface, table surface to man. Okay, needing either direct, like scabies, you shake hands with somebody who had scabies, you get scabies, or COVID, or tuberculosis when somebody breathes on your neck or breathes in front of you, and then droplets of bacteria can cross, or you need a vector like diseases which is mentioned earlier, like onchocerciasis, needs a specific vector. And here, these vectors are intermediary developer of the bacteria or of the virus or parasite. Okay, and then you have mechanical vectors like flies. They just sit on a feces and then transfer in the legs the feces with the bacteria into the food of somebody else. So this is communicable disease. The non-communicable diseases is now taking the lead in many parts of the world, because now infections are getting less apart from the epidemics. And non-communicable diseases by WHO is heart disease, stroke, cancer, diabetes, and chronic lung disease. Plus, mental health diseases. So these are non-communicable diseases, all right? And now they claim 74% of all deaths in the world due to the non-communicable diseases. All right. So we are shifting, from the communicable diseases and as a cause of mortality into the non-communicable diseases. And cancer, definitely, of today's topic falls under the non-communicable diseases. Okay. The WHO is very much worried about NCDs, that they put a, a goal of what is called 25 times 25, and it is part of the sustained development goals of the United Nations. What is 25 times 25? In the year 2025, there should be a reduction of the burden, world burden of the disease by 25%. If we're going to achieve that, this is still in doubt. All right. And hopefully by 2030, we'll reduce the load by one third. This is an indication of how the world is conceiving those non-communicable diseases. Okay, when we come to cancer, in the tropics, we are talking about top infections. All right, are there cancers which are drawn by infections or they are affected by infection? The outcome is affected by infection or by socioeconomic status. There are bundle of factors which determine the occurrence of disease. Every disease has no single factor. It is a bundle of factors or variables. If these variables meet, then the disease appears, if it's a cancer or cardiovascular disease or whatever. Okay? So, what are the factors which we have been alluded to in previous lectures in the tropics which may determine the disease? Number one is poverty. Okay, very important. Poverty is an economic, socio-economic problems, social problems like fear of stigmatization of disease. People, they have cancer even in Sudan. We used to have this. They don't want people to know that they have cancer, particularly ladies with cancer of the breast. Okay, so fear of stigmatization, beliefs, general beliefs, may be religious or tribal beliefs about diseases, and this will delay diagnosis and treatment. Number three, the consanguinity of tribes. People are marrying from each other, okay? And then things like, effect of genes, certain genes, which are having an upper hand in certain tribes, like sickle cell disease in Sudan, it's mainly in the west, in the Miseria tribe and Rizaidat type, Rizaidat tribe. Thalassemia is in the north, with those who have Turkish genes. Okay, so these are another factor, the genetic build-up of the patient. Then malnutrition in tropics, again, is very important. And this malnutrition may be total, like starvation, or marasmus in children, or maybe selective, deficiency of vitamin D, deficiency of zinc, and so on. So these are the factors which will determine the presence or the absence of disease. So, in summary, now we are talking about not tropical countries, we are talking about low, medium income countries. Okay, these are where we live now. Low, medium income countries with a lot of cofactors which are responsible of producing the disease. Let us concentrate on cancer. Okay, um, the Human Development Index is always should be remembered. Human Development Index. It is better an indication of lack of development. If you say Human Development Index is better than saying low medium income countries. Okay, because after all, if the human is developed not only from social background, economic background, but from educational background. So we need education and literacy among the individuals to accept advice, to accept methods of control of diseases. And one important consequence of all this is accessibility to healthcare. Accessibility to healthcare. Not only accessibility reaching a health center, but what is in the health center that may help a patient to achieve cure. Okay, so accessibility. And one of the worrying index in the world is lack of accessibility of patients with cancer to healthcare. And this is the disparity is so wide between tropical countries and European countries as far as cancer is concerned. All right. In all countries, cancer is about collection of geographical variation in cancer, the particular type of cancer, the ethnicity, the age, where it is found, what are the cofactors which are determine the presence of that disease. And here we need data. We need data relating to the where is it, the occurrence of it, the type, the incidence, okay, the mortality rate of the patient with that cancer, and then the worsening factors and the access to treatment. So this is needed from all over the world. Unfortunately, in the tropics, we have paucity of information regarding cancer. It's a complex disease. It's a very complex disease. You need to be diagnosed clinically. You have to have a histopathological diagnosis, okay, and then you have to have a good follow-up about how it progresses, metastasis or non-metastasis, hormonal disturbances, cytotoxins. So this is really needing good clinician. And when it comes to treatment, then this is where the countries of tropics fail because the treatment is very special. Cytotoxic drugs are highly specialized, are highly toxic, are now in development. You have immunotype, okay? You have hormonal type of cytotoxic drugs, and these are not available. These are not available in the tropics. More so, you need radiotherapy, and radiotherapy is very expensive. It's very expensive, and it is cumbersome. So, looking just into the African countries, I could see very few centers for radiotherapy. Sudan has been lucky because that center has been there for more than 50 years, almost 60 years. But in Africa now, I visited almost 30 countries of Africa. There are very few centers of competence of radiotherapy. So all the disease stops at the diagnosis. Treatment is, very poor, very small, very little, and progress is again is hampered by a lot of factors. So mortality is very high from the cancer. So what are the international agencies which deal with data collection? We have International Agency for Research on Cancer, International Agency Research Council, which is capital I, capital A, capital R, capital C. And this is known as an international agency for research in cancer. This is collect a lot of disease, a lot of information from different parts. And we learned quite a lot from the geographical distribution of cancer in different parts of the world. Um, and then we have the Global Cancer Observatory. Global Cancer Observatory, Global G, capital G, Cancer C, capital C, and Observatory GCO. This is an interactive website platform which will accumulate a lot of information regarding cancer. So, and because of these, uh, data which was being collected, Burkitts have discovered or have described the presence of Burkitt's, what we call Burkitt's lymphoma, in a belt of falciparum malaria in Central Africa, going from Uganda along that line, and being associated with EB virus, Epstein-Barr virus. Okay, and if you are to talk about a tropical cancer, Burkitt's is a tropical cancer because it's the commonest cancer in children between 4 and 7 in the tropics. Okay, we'll come to that when we talk about infection and cancer. But but that is the way, collection of data can be helpful. Okay, what are the how can we measure outcome of cancer? Outcome could be cure, okay, which is not very common in Africa, or it could be death, mortality, all right, or it could be mortality is the end, okay. So if people died, that is the end of it. But between the disease diagnosis to the death, there is a period. This period is a few years, maybe longer, but these can be measured, okay, but what we call DALIs. It is capital D, capital A, capital L, capital Y, and S, DALIs, which is disability adjusted life years, uh, disability adjusted life years, DALIs. And it is a sum of life years, okay, lost due to premature mortality and morbidity. So it measures illness as well as, death. So if you lose 10 days, the sum of all the years which you have been not working, you have been in pain, you have not been, walking, you have not been enjoying family life. These are lost years, and this is what we measure by days. Okay. Um, so the what we need from this data is the occurrence of new cases, and this is called incidence. And incidence is a measure of new cases in a particular population, limited population, over time. That is incidence. So if we know the incidence, CA breast occurring, okay, each year, 20 in a village which is outlined. Okay, we don't have data from outside, and we don't have data disappearing from our village. So this is the incidence, and it is important. Okay, and why do we need this data? We need it for to discover the etiology of the cancer, the factors which will bring that cancer to the being, and then it is in planning. Definitely, if I have more cancer of CA breast here in a certain area, you may need more surgeons. It helps in planning and prioritization of treatment. Okay, and then we'll have the impact in the health system. So it is important to have the case reported, and the reporting could be from clinical diagnosis, which is not very accurate, but it has to be based on histopathological. We should have, every country should have what we call a cancer registry, and data are collected from histopathologists who are working in the public, in the hospitals, and in the private. Okay, this is a cancer register. It has to be an updated registry showing the number of cases, the type of cases, and possibly the outcome. Okay, the mortality rate is the average risk to the population of dying. It is the average risk to the population of dying from a specific disease. This is mortality rate. Mortality is death, of course, is dying from a disease. So it is an index. It's a very important index of diseases, the mortality rate. Okay, cancer now, we talk about specific cancers. Generally, there is a very high increase in cancer rate. Okay, if we take in 2008, we have about 28 million cases. This is what we call world burden of cancer. World burden of cancer. 2008, this is 28 million, and 218, that's over 10 years, it jumped to 43 million. That is an increase of 50%. And we reckon that 60% of all cancers occur in low, medium income countries. So this is a burden on top of the infective communicable diseases. Now, the tropics and the low income countries are being loaded with a disease like cancer, which is very expensive in diagnosis, very expensive in treatment. It is calculated that, in the coming years, that one in every five men will get cancer, and one in every six women will get cancer. Okay, the top cancers is CA breast all over the world. It's not only in tropical but all over the world. Seconded by lung cancer, and then colorectal cancer, prostate, then stomach, and then liver cancer. These are the top five or seven, top seven cancers. However, the prognosis and the mortality rate is different. While CA breast is the top of all cancers as far as incidence and world burden, it is the number five in mortality. Okay, and lung cancer, which is the second prevalent, it is number one mortality. So people die from lung cancer, and people may live with CA breast. And the reasons is, okay, CA breast is superficial. Two, there is awareness among ladies. Okay. Three, if it is caught early, simple surgery can help. Simple surgery can help. Just take the nodule or the area of the cancer with some margin of it. Okay, so it is of better prognosis. But the cancer, CA breast, is increasing. Lung cancer is second, colorectal cancer, then followed by prostate cancers, stomach, and liver cancer. Okay, 50% of 60% of those cancers are in tropical or low income countries. Okay, what are the infection related cancer? And this is where we're now talking about tropical in a better sense, okay. Um, the the one which we really emphasize is CA cervix. CA cervix is definitely caused by human papillovirus, human PVHPV, human papillovirus, or human papilloma virus. And this is a virus which we get early in life. Okay, it doesn't only cause CA cervix, it also cause warts around the anal air region, and can cause other cancers like anus. So I'm just giving you the different types, and then go on discussing each one. Stomach. The stomach is H. pylori. The H. pylori does not only cause ulcers in the duodenum and stomach, but also is a cause of cancer of the stomach. All right. It lives in the lining of the stomach, and it was discovered, almost by chance. And now it is being blamed for a lot of cancers, particularly in Japan and Korea. Liver, the virus is B, definitely, and C, all right? But there is a toxin which is called aflatoxin, which is found in nuts, peanuts, like full Sudani, all right? This aflatoxin is also carcinogenic. And then we have the EB virus, as we have already said, and this causes EB virus, Epstein-Barr virus, Epstein-Barr virus. Um, it is a virus which is transmitted by saliva in childhood, and almost 90% of all population all over the world have this EB virus, but in a latent stage, in a very latent stage. But then, if it is uncovered by immunity or low immunity, then it appears as a cause of virus, not only the Burkitt's lymphoma, but all viruses and uh, oropharyngeal viruses and lymph node viruses. Okay, we will come to the uh, infection, because this is important and it is controllable. By the way, 50% of all cancers could either be prevented or cured, So these are important aspects of decreasing the burden. Vaccination and early diagnosis, all right, to cure. So 50% is curable or preventable. All right. Simple vaccination. Human papilloma virus can be vaccinated. Children, girls especially, can be vaccinated when they were between 9 and 14. And this is a vaccine. They have to be vaccinated before menarche, and this will prevent the papilloma virus from being there. And areas where this has been adopted, the CA cervix, the exfoliative type of CA cervix has been prevented. Working in Tanzania now, I'm told that there is a lot of CA cervix, and I'm sure students who work, say, in Muhambili have shown almost walls full of CA cervix. Okay, that is one easy one to control, but easily said than done. Because vaccination is a big task, giving it to each girl, before menarche. The second thing is the second vaccination, which prevent cancer, is hepatitis B. Hepatitis B vaccine, which luckily all our students in UMST, be them dental or medical, have been vaccinated. 3 shots of a vaccine against hepatitis B, and this is important. And my advice for all those who graduate, as you know, especially in dentistry and also medical, should receive a booster dose before starting their career. But luckily, all of our students are being vaccinated. Okay, what are the factors which influence cancer development? Apart from infection, is tobacco. The most documented cause of cancer is smoking, tobacco smoking. It is estimated that there is 1.1 billion individual in the world who smokes. Unfortunately, 60 or 70% of them are in the low and medium income countries. And this is very dangerous. It reaches up to 80% in some countries that they are smokers. So the whole world, are smoking. The smokers are in the low income countries. We have enough of problems. Why do we add another one? You know. So tobacco, I cannot see myself in my brain that anybody wise enough to smoke, and it is dangerous. It is very dangerous. And if we just advise from the 1 billion, half of them is, you know, reducing or cutting out smoking, then this will save at least 300,000 lives. It is so bad. And smoking, everything is not only for lungs, but also for other non-communicable diseases like cardiovascular disease, stroke, peripheral vascular diseases, and others. But also now there is evidence that smoking can also affect other other areas by cancer, stomach, esophagus, prostate, and even CA breast are being influenced by smoking. All right. Unfortunately, now there is a widespread use of shisha. Shisha, as you know, is almost a fashion, especially among girls now. They use shisha, okay, and this is more dangerous because what you take in is a big load, a big dose of nicotine. Okay, you don't feel it because it goes in the water, it becomes cooler, and then becomes nicotine comes into your lungs with humidity, with vapor, which makes people relax. Unfortunately, in the Middle East, it's almost a fashion. Even in Sudan before the war, all those Sitat al-Shai are now providing shisha, which is a very, very bad habit. But it's dangerous. It's very dangerous. So hopefully, people should limit or abandon smoking. In Sudan, there was first line research in Tumbak, okay, Safa. Tumbak is contains nicotine, contains hatrun, okay, and contains other stuff which will enhance absorption of the nicotine from the mouth. It's either put up there or down there. Some people put it there for short periods, salivation, comes out, and people are sometimes forced to spit it out, and then they can spit it out in public, which is not a very nice thing to do. The frontline research has been done by people from dentistry, particularly Noor Ibrahim, Ahmed, the ex-vice chancellor of the University of Khartoum, and then Ali, who is a pathologist, with the publication of tobacco-induced cancer, not only of the gums, of the tongue, okay, of the oropharynx. These are the areas which we should remember as a cause of tobacco. And tobacco is a definite carcinogenic, just like smoking, definite carcinogenic. Okay, so if we cut half, just half of the smokers, or half of those who use tobacco, we can save up to 30 million lives in that process. So remember always that there is a chance of controlling cancer. Okay, the infectious agents which are most probable, most important established cause of cancer is we can control it. We can control it. Let us take H. pylori. H. pylori is the halazonia. It's a very funny bacteria found in the colonizing the stomach lining. Stomach lining. It is a cause of duodenal ulcer, uh, gastric ulcer, and adenocarcinoma and non-Hodgkin lymphoma of the stomach. And we have noted that there is a very high incidence of CA stomach in Japan and Korea, and this is definitely related to H. pylori. But the control of H. pylori have really shown a drop in the prevalence and the burden, cancer burden of CA stomach. So this is an evidence that this is related to the infection. Okay. Uh, most people, up to 90% have the H. pylori, but why certain people will develop ulcers, why certain people develop cancer or adenocarcinoma, why certain people will develop non-Hodgkin lymphoma of the stomach is needs some elucidation. For instance, in EB virus, which is Epstein-Barr virus, as a cause of Burkitt's lymphoma, what is the reason that malaria is associated? And it is supposed to be, although EB virus is colonizing many people, or almost 80% of people, or 90% of people, but only a few will develop Burkitt's lymphoma. And we think the falciparum malaria may disturb the immunity and gives upper hand of EB virus infection. So Helicobacter is one cause of cancer, and then, as we said, human papillomavirus is another one which can be controlled and vaccinated. Hepatitis B and C are again the cause of cancer. You remember bilharzia? Bilharzia, especially hematobium, is a carcinogenic in for the bladder. And here we are talking about squamous cell carcinoma of the bladder. All right, the normal, naturally occurring cancer of the bladder is the transitional cell carcinoma. But with schistosomiasis, hematobium, it is squamous cell carcinoma. Squamous cell carcinoma. Similar to the lung, tobacco will increase the prevalence of squamous cell carcinoma in the lungs and less the adenocarcinoma. So it may be that the squamous cell carcinoma comes up after major irritation. Okay, uh, how is hepatitis B contracted? Okay, hepatitis B is contracted by parenteral, by blood, by the blood, okay, or by sexual intercourse, particularly anal intercourse, because the columnar epithelium is fragile, and if you shoot ejaculation, then you may break in the colon and gives you higher incidence of disease of hepatitis B. All right, saliva is not the case. All right, and when it and parent vertical from mother to child, usually in the delivery period, because that is where blood mixes up, and in perinatal period. Perinatal meaning the early days of the neonate being suckling the milk, This is where hepatitis B can be contracted. And this is an important aspect because most of those who get liver cancer have contracted hepatitis B for a very long time, uh, more often than not during childhood. Hepatitis C, hepatitis C is again contracted by parenteral. It is a less of a cause of CA, but it is a definite cause of CA liver. Okay, it is contracted parenterally, uh, very little by sexual intercourse, unlike hepatitis B. Okay, so it is that is hepatitis B, which can be vaccinated. Unfortunately, we don't have up to now a vaccine against hepatitis C, but there are drugs which will take it out of the body, very strong drugs, antiviral drugs, which will clear the body from hepatitis C. Hepatitis C is very common. Hepatitis B is common in the tropics. We reckon that there is at least 10% of individuals who have hepatitis B, and hepatitis B could lead to cirrhosis or could lead to active chronic hepatitis. And both of them can lead to cirrhosis, and cirrhosis in itself a carcinogenic pathology. If you get cirrhosis from alcohol, not from hepatitis B, then people can develop hepatocellular carcinoma. So if you are a carrier of hepatitis B, if you drink to the extent of getting cirrhosis, then the chance of getting hepatocellular carcinoma is high. This is a very, very, very aggressive type of cancer. And previously, we have done some studies because it's common in Sudan. The life expectancy of the Sudanese CA or hepatocellular carcinoma, it does not exceed 9 to 1 year of life. Okay. Coming back to the Burkitt's lymphoma, this is geographically bound. And as I said, if you wanted a tropical cancer, this is Burkitt's lymphoma is the cancer. Okay, it is in a belt of where malaria is hyperendemic, falciparum malaria is hyperendemic, and the EB virus is a factor. Okay, what happens? How do we contract EB virus? It is through saliva. 90% of the whole world have EB virus. Okay, through saliva. Okay, and it goes in the body, causing lifelong latent infection. Lifelong latent infection. If your immunity is suppressed, then the disease can appear in different forms. Okay, in different forms. So, like Burkitt's lymphoma, Burkitt's lymphoma is an aggressive form of lymphoma involving the jaw here or periorbital region. But Burkitt's lymphoma can occur episodically or periodically intestinal in the ileocecal area, giving a lymphoma of the bowel, leading to either obstruction, intestinal obstruction, or bleeding. Okay, this is another area of affection of Burkitt's lymphoma. So it is a disease which can respond to treatment. It is a disease which responds to treatment. Okay. There is something called cytotoxic T cell response. Okay, cytotoxic T cells. Okay, uh, the Burkitt's lymphoma, the EB virus will cause transformation of B cells, leading to getting off into multiplication. And this is usually controlled by cytotoxic response or cytotoxic T cell response and this is maybe disturbed by malaria. All right, and gives you the frank, aggressive type of Burkitt's lymphoma. Okay, it can, if you have a disease like that, then it can respond to cyclophosphamide, or corticosteroids initially, but it needs an intensive multi-drug therapy, multi-drug cytotoxic therapy to reach cure. And cure is a possibility. Cure is a possibility. Okay. Kaposi sarcoma. And this brings us to the Kaposi sarcoma, which has been a rare tumor, okay, before the appearance of HIV. Okay, what is Kaposi sarcoma? Which part? It is the lymphatic endothelial cell cancer. Lymphatic endothelium meaning the inside of the endothelium cells. All right, and it is caused by human herpes virus number 8, HHV8, human herpes virus, or what we call Kaposi herpes virus. Okay, so it's a herpes virus, and it is related definitely to HIV because this tumor appeared 20-fold more after HIV/AIDS. Okay, and in areas where ART, which is antiretroviral therapy, has been implemented on a large scale, the prevalence and the incidence of Kaposi sarcoma has been less. Okay, so it is definitely due to immune suppression, and it occurs in most cases when CD4 is less than 200. You remember, we classified the severity of HIV according to the CD4. These are lymphocytes, okay, with the antigen or the receptor of the CD4 there. And these are protective immuno B cells. And once this is affected, the number of these um, lymphocytes decreased by HIV, killed by the virus, then the number which goes down, then it gives you a lot of problems like opportunistic infection, cryptococcal, and all the rest. And part of it is the tumors, Kaposi sarcoma. Kaposi sarcoma appears in the skin, like, starts as papules, and the nodules will be hard nodules, like grapes of nodules. But it can also be internal, in gastrointestinal, all right? Uh, and Kaposi sarcoma can go to the can cause intestinal obstruction, can cause lymphedema, okay? It can cause oral lesions, all right? And even can be affecting the hard palate. They can affect the hard palate, leaving you ulcers. So it is not only limited to the skin, but it goes in other parts of the body. So is HIV the virus? Is it oncogenic? I think the evidence is not. Is not. It causes carcinoma because of depressed immunity. Because of depressed immunity. But research has not shown that HIV virus in itself is an oncogenic. It is most probably through, and definitely through, the depression of immunity. Okay. Okay. Since we have 5 minutes, I would like just to touch on another factor. Okay, apart from the ones which you have mentioned, is Obesity. We are talking about poverty, malnutrition. Are we going to talk about obesity in third world or low income countries? The answer is yes. The answer is yes. Obesity is a major disease in the Middle East where food is, available, where people just walk on food, okay? They are enjoying high, prosperous life. So children, one third of all children in Middle East is obese. How can we define obesity? Obesity either it is an overweight or obese. And obesity is a disease. Obesity is a disease. So the BMI, okay, the BMI, okay, which is weight over height square. If you 100, if you are 100 kilogram body weight and your height is 2 meters, then 100 over 4, your BMI will be 25. Okay, it's weight against height to square 2. Another, the example is if you are 100, all right, over your height is 2 meters, then it will be 100 over 4 because we multiply 2 by 2 before, and you'll be 25. Okay, if 25, if you reach 25 in an adult or BMI, then you are overweight. If you reach 30 and above, then you are pathologically obese. You are pathologically obese. Okay, so there is an increase even in urban areas of the third world obesity. Obesity may be genetically determined, maybe epigenetic factors, all right, and definitely due to overeating. And I suspect that because people in poverty, they eat a lot of starches, okay, these will cause obesity. At any rate, people are getting more lazy, and lack of physical activity, lack of physical activity. You are young, and I would like to ask you, what do you mean by physical activity? You are either categorized as physically inactive or physically active. All right. I will say that if you are physically active, then the chance of getting coronary artery disease will be reduced by 50%. If you just do an exercise 4 or 5 times a week, then that will reduce coronary artery disease by 50%. Let us define, because not all people are just walking between room and room or walking, lazily from their flat to the hospital. These are physically active. They are not. It is defined like this. Number one, you could 30 minutes of moderate to intense physical activity. 30 minutes of moderate to intense activity at least 5 days a week. At least 5 days a week. Okay? So moderate to intense. I mean, if I'm walking without as leisurely as I could, then this does not define physical activity. You are physically inactive. The intense to moderate, meaning if you walk, you jog, harwala, okay? To the extent that your pulse will be raised and you may sweat. So that is what we call 30 minutes of this type of activity for 5 days a week. 5 days a week. هرولة سيدة هاجر لما كانت تبحث عن الماء لسيدنا إسماعيل هرولت بين الصفا والمروة. There is an area where she هرولت, and this is what we need to remind you. Or you have 20 minutes of vigorous activity. Vigorous activity meaning you are devoting yourself to a gym, a cycle, or 20 minutes of very intense physical activity, 3 days a week. 3 days a week. Okay. And it is associated, physical inactivity has been associated with a lot of diseases. Obesity has been incriminated in CA breast, funny, CA breast, prostate, colonic cancer. There is a marked increase in the prevalence of the incidence of these diseases, CA breast, colonic, prostate, and threefold increase in endometrial cancer. Threefold increase in the endometrial cancer. So ladies who are getting obese, they may have CA breast, and more important, they may have endometrial cancer. It is being reported statistically that there is a threefold increase in endometrial cancer if a lady is obese. But other cancers are being associated with obesity, like kidney, gallbladder, pancreas, okay, and adenocarcinoma of the esophagus. Okay, so physical inactivity not only can affect cancer, but can sedentary life, which is lack of inactivity, can lead to CVS, cardiovascular, cardiovascular system disease, can lead to mental health, and it's important to remember that, and can lead to diabetes, and definitely can lead to cancer. So obesity is a disease which contributes a lot to the non-communicable diseases. Okay, so that will end the 60 minutes of today's lecture, which we have been going through the cancer, and we change the concept of tropical diseases into diseases in the tropics so that we can encompass other factors which are contributing to the disease. Uh, I feel sad when I go in Africa, visiting country after country, seeing there is no progress, very little progress towards getting up into up and going. And I think the world has been divided into those who have and those who have not. All right. And I think superpower, unfortunately, have a feeling that they wanted this division of the world to continue, the division of the world. And what is happening in West Africa now with all these revolutions, and nationalization and national sense of ownership of the country by their people is happening across Africa, in West Africa. And we hope by proper education, proper awareness, and raising literacy among non-educated people that we could achieve a better life for African countries. With that, I would like to conclude and hopefully uh, see you in next week, same time on Sunday. Thank you very much indeed, and God bless.